So this is a guide for clinicians providing mental health services to clients that are deaf and hard of hearing. I'm Leisha Campbell. I'm a psychotherapist in the greater Houston area. I have over 16 years of counseling experience and working with deaf and hard of hearing individuals. So this presentation will have 3 parts. We strongly encourage you to view all parts 1, 2, and 3 so that you get a better understanding of all of the facts, barriers, and factors that will influence accessing mental health services and supports and things that you can provide to support deaf and hard of hearing clients better being able to access mental health services. So what are some of the facts and statistics throughout the general population? So first, 1 in 5 U.S. adults experience mental health illness each year. That's astounding. 1 in 25 U.S. adults experience a serious mental illness each year. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder every year. 50% of lifetime mental illness will begin by age 14, and 75% will be diagnosed by age 24. Suicide is the second leading cause of death among people aged 10 to 34. We'd like to emphasize that 3.7% of U.S. adults will experience a co-occurring substance use disorder and mental illness. That was as of 2018. Basically what that means is a lot of times when someone is experiencing a mental illness or depression or anxiety or bipolar or any diagnosis that may be affecting their daily life, they may not have appropriate coping skills, and so sometimes they will use legal or illegal substances to help them cope. So now some facts about hearing loss. About 2 to 3 out of every 1,000 children born in the U.S. will have some level of hearing loss in one or both ears. 90% of deaf children are born to hearing parents, and that also means that's approximately 3 to 6 of the population have some degree of hearing loss, and that can range from being able or having difficulty understanding spoken conversations or to having a complete hearing loss. So within the deaf and hard of hearing community, we have very limited research. But among the research that we do have, we have noticed a greater incidence of mental health diagnosis, although compared to the general population, the statistics and percent and rate of the incidence of mental health illness is very much comparable to those in the general population. But in the deaf and hard of hearing community, due to a significant number of factors that we will review, there is a greater incidence that a deaf or hard of hearing child will have a social emotional difficulties or a mental illness by the time they're an adult. So among the research that we do have, according to Black and Glickman, we have a significant number of deaf individuals that have attempted suicide. That can range to 30% that have seriously also considered suicide. So among deaf women, there's a rate of 65.1% for suicidal ideation. Basically what that means is that when you are a deaf or hard of hearing individual, if you don't have the supports, the access to mental health services that you need, then the likelihood of the suicidal ideation or attempted suicide would be at a greater increase. So why are deaf children and adults at higher risk for emotional difficulties and mental illness? One of the number 1 reasons is communication difficulties between the parents and deaf children that impair the detachment and the bonding process. Many times when the parents are given a diagnosis of hearing loss, they may have not ever had an experience of being around a person with a hearing loss, a deaf or hard of hearing individual. So they may not have any knowledge or resources before that diagnosis has been given to them. So most of the time with the hearing parents with a hearing child, sometimes the hearing parents are more just forthcoming in a therapeutic environment because they have a strong relationship with their child, so when they come in and give you background information, they know most likely what the problem may be. They may not know the specifics, they may not know everything that's involved, but they can usually kind of tell you like what has happened and why the child might be feeling the way they're feeling. With a hearing parent with a deaf child, a lot of times they don't know, and they will just tell you everything is fine. I don't know why they're acting like this. I don't know why they're mad. I don't know why they're throwing things. I don't know why they're slamming doors. I don't know what to do with this because I'm doing everything I can for them and I buy them all these things and they're just mad all the time. So a lot of times with the hearing parent with the deaf child, I get the parent just frustrated a lot and them not recognizing that not communicating with their child over a number of years about just daily life, about what's coming next, about how was your day at school. Those parents can't have those conversations. When their child comes home, it's like, how was your day at school today? What was the best part of your day? What was the worst part of your day? Did anything happen with your friends? What special projects are y'all doing tomorrow? Are you going on a field trip tomorrow? Those conversations don't happen. And so even just family events, family vacations, special family dinners with extended family members, grandparents, aunts and uncles, those conversations don't happen. So a lot of times the deaf or hard of hearing child just feels isolated or disconnected to the family. And a lot of times the hearing parent, if they don't sign, they don't realize the child is feeling that way. So when babies are born from ages 0 to 5, their brains are ready to learn language and have language acquisition, no matter which language that is. It could be English, French, Spanish. If you are a deaf child of deaf parents, that may also be American Sign Language. So that becomes your dominant language, or what we call your L1. For many deaf and hard of hearing children that are born to hearing parents, oftentimes they do not ever establish a L1 or a dominant language, which also can cause a significant increase of risk of emotional difficulties or mental health illness later on in adulthood. Mental health access is very difficult for most deaf and hard of hearing individuals. It is very hard for deaf and hard of hearing individuals to access the mental health system. Part of that is due to not knowing the resources and knowing where services can be accessed. About 2% of deaf individuals receive appropriate treatment for a mental illness. When you have a serious mental illness, or what we call SMI, and children with serious emotional disturbance are likely greater in the deaf population than the hearing population, and sometimes estimated to be 3 to 5 times greater. So part of the parent-child attachment and bonding, most of the time when parents have their babies, they are holding them, they're nurturing them, they're talking to them, they are playing with them and providing them nurturing and love. When you have a child that has a hearing loss, sometimes the parent is in the grieving process, and that inhibits the natural parent-child attachment bonding process. So many parents, when they receive that diagnosis, still go through the stages of grief, which are denial and isolation. So they deny that it's even a fact. They are angry, either angry at the doctors, angry at the situation, bargaining, wishing that it was not so, trying to find different ways to handle or not have the hearing loss. Depression is also a very real symptom that some hearing parents also experience. And then finally, acceptance. There's no order of those 5 stages of grief. Sometimes they happen in order, sometimes they happen multiple times. Some of the examples of that is when the deaf or hard of hearing child is younger. After the diagnosis is given, they may receive hearing aids or cochlear implants for amplification. A communication mode may be established, whether that is oral and auditory skills being taught and emphasized, or learning American Sign Language. But in addition to that, as that child is growing up, if they have siblings, the parents will notice different developmental milestones that the siblings are reaching that the deaf and hard of hearing child may not. As they continue to grow up until teenage years and adulthood, the parent may realize some things that their child may not be able to do that other kids may not. So oftentimes we will see the parents reliving the grieving process, and as professionals, we help the parents through that process. So the barriers in accessing mental health and deaf and hard of hearing clients to accessing mental health services include a lot of different factors. First of all, the deaf and hard of hearing client may not have knowledge of where to find help if they're experiencing depression or anxiety or another mental illness. They may not understand the therapeutic process, so how to actually sit down with a counselor, how to express your feelings, how to trust that a person will listen to you, believe what you say, and actually support you in their process of what you are dealing with. In addition to that, in the mental health world, there are not enough clinicians that know how to work with deaf and hard of hearing clients. Also, they do not understand deaf culture. So sometimes they will become frustrated in the process. For example, if a teenager that is deaf accesses just a local community mental health clinic, and that clinician, let's say, is doing cognitive behavioral therapy, if they're asking a lot of open-ended questions and the deaf client is not able to answer them without that clinician giving them choices or giving them a life experience that they can relate to, the clinician may assume that the deaf person is not a good candidate for the therapeutic process and may end therapy without the deaf client actually receiving the services that they needed. The language, reading, and writing level of a client also impacts their access. A lot of the questionnaires that you have to fill out upon entering a mental health service, or HIPAA forms or privacy forms like informed consent, may be very abstract and convoluted to a deaf or hard of hearing person that has not seen those kinds of forms before. They may need some help understanding that. If you are a clinician that has not worked with deaf and hard of hearing clients, you may not understand that this is a barrier and may not realize that that person needs assistance in understanding the forms or filling them out. The communication mode of the client is also a barrier. So some deaf and hard of hearing individuals use their auditory skills and their oral speech to communicate with hearing people in the world, and some of them with more profound hearing losses use American Sign Language. There are very limited mental health clinicians that are fluent in ASL, and so that presents another barrier. In addition to that, most mental health clinicians and therapy offices do not have staff interpreters. So most of the time they are seeking agency interpreters, and there's a significant cost associated with that. So sometimes the deaf or hard of hearing client may be turned away if they live in ASL, if they use ASL, and they will just be said, we don't have interpreters. So what are the key components to considering when working with deaf and hard of hearing clients? Their main mode of communication is very key. As a clinician, you need to not assume what their mode of communication are. It may be very different depending on the client, and it's their preference. You need to ask them, do they prefer just talking? Do they prefer using sign language? Do they want to use a sign language interpreter or not? You have to ask those questions as the client's preference so that you can provide the best access to mental health services. In addition to that, their childhood background is also very important. You should ask a lot of questions. Despite your theoretical framework, you should still ask a lot of questions about their childhood, where they grew up, what kind of school they went to. This will give you a lot of knowledge of their life experiences and things that may have influenced the reason or presenting symptoms that you may be seeing the client for. The other thing to think about is parent, caregiver, and a support network. Did their parents sign if they use sign language? Did their caregivers support them? Did they accept their hearing loss? Did they accept who they are and their identity? Does that person have a strong sense of identity as a deaf and hard of hearing person? And if they don't have a strong family connection, do they have friends that support them? All those things are very key into being able to assess the deaf and hard of hearing client's needs. Also, childhood and adult trauma or abuse can be very significant, and you should ask. The deaf or hard of hearing client may not openly just express that. You as the mental health clinician may be the first person that they have ever felt comfortable reporting that to or felt safe reporting it to. Or they may have told a family member, and a family member may not have believed that the abuse or trauma occurred. Their social and self-identity is also very important. As a deaf and hard of hearing person grows up, some of them have a very strong sense of identity. They have deaf and hard of hearing friends. They're in an environment in school and their family that supports them being comfortable in however they want to communicate, their interests, whoever they want to become. However, in other situations, there is discrimination, frustration, oppression, and barrier to just living normal life. For example, if you are in a family and you use American Sign Language but your parents don't sign and you're sitting at the dinner table and everyone's laughing and talking, you may not be included, and then you walk away not knowing what happened. Or the family is planning a family vacation. Everyone else in the family that's hearing may know the details of we're going to Disney World, but the deaf or hard of hearing child may not have any idea that those things are happening. All of those things are very important in developing your social and self-identity. Then the current level of daily life functioning. This is also very important. Is the deaf or hard of hearing individual able to be successful in school right now? Are they able to keep and maintain a job successfully? Are they having a quality of life and experiences where they feel that they're successful in their life, both professionally and personally? So there's some different methods of obtaining this information. So if it is a child or an adolescent, one of the best places to get a release of records is from the child's school. So the IEP, or the Individual Education Plan, or the R document will give you some of that information. Some key places to look within that document is the present levels of academic performance. It basically just gives you a story of the child. It tells you what they can do as far as their listening skills, their speech, their current reading, writing, math, and also their social emotional levels, and if there are any behavioral concerns that the school is concerned about or have implemented a plan for. In addition to that, what kind of accommodations are they receiving in school? These will also help you to know what possible accommodations they may need for mental health services. Are they provided copies of notes? Do they use any kind of FM system, which is a device to help amplify the sound? And also, do they use a sign language interpreter? In addition to that, there's a full and individual evaluation, or psychological eval, and that will let you know the disabilities that the school system has assessed of the deaf and hard of hearing child. That may include deaf and hard of hearing, speech, other health impairment, ADHD, if there's an intellectual disability present, autism, or any other psychological factors that may be present. And in that document, the best place to look is in the summary of recommendations. It gives you a quick summary of what the kid needs and what would be best to serve that child. So outside of the educational system, some other ways to obtain background information for children, adolescents, and adults is by obtaining medical, psychological evaluations. These may have been done by a psychiatrist, a medical practitioner, or also if it's an adult and they have a Texas Workforce Commission vocational rehab counselor, they may also have some of that information. Also focusing on social development and family background information that may be in some of those reports, any diagnosis, medical conditions, the cognitive functioning of an individual, and any previous trauma or abuse that may be noted. This is important because the deaf and hard of hearing client may or may not be able to tell you all of this information. So the more background information you can gather ahead of time or while treating the client will help you provide a better quality of service. So some different methods in addition to that is conducting a psychosocial interview with the deaf and hard of hearing client yourself as a practitioner. So you may not have access to those evaluations, or the client may not have had any of those evaluations done before. So you would need to gather social development information, family background information, educational and language level. What some of those things look like are just asking questions like, did your parents sign? How many people are in the family? Where did they live? Did they move a lot? Having them list different addresses, seeing if they can denote where they live. Was there a lot of moving around? Where did they go to school? Did they go to a mainstream program where they went to school with deaf and hearing kids, or did they go to a state deaf school where it was mostly around deaf students, deaf teachers, and they got a good strong sense of deaf culture. Also, establishing their language level is also very important, and that can be done in also a variety of ways that we will go over later on. Consider effective methods of interviewing the client. Some of those include a written questionnaire if the client is able to fill those out, or oral responses where the client is able to verbally tell you and you write it down if they have oral speech skills, or if they use American Sign Language, using a sign language interpreter to complete those. All of those things are things that we consider when we are looking at the facts, the barriers, and the key components of accessing mental health services for deaf and hard of hearing clients. So with young clients, sometimes they are upset or they come in and you may not know what's wrong. So some of my personal experience in a clinician and trying to support that is we had one little girl who she came in and she was pouty and she was crying and she was upset. She wouldn't sign, she wouldn't gesture, she would not communicate at all. And so I started the process of just asking different questions like, are you mad? Are you sad? Or did something happen at home? Are you mad at your brother? And she would not answer me at all. And so after that, I gave her some paper, asked her if she would like to draw, if she could draw what happened. At first she didn't. Then she drew me a picture and it was like mom, dad, and a couple brothers. People were crying. One person was yelling, but I still didn't know exactly what had happened. So normally in that case, when you have the drawing and you have the child and you still can't figure it out, I contacted the parent to come in to join the session and just kind of ask them kind of what was going on. Did something happen last night? And at first the parent was like, well, no, nothing's happened. Everything's fine. And I'm like, well, she's visibly upset and she signs, you are not able to communicate with her. So I really want to support her in expressing her feelings. And so then the mom talked about how the mother and dad had gotten into a fight last night. Normally they don't argue in front of the kids, but last night they did. And so the little girl was upset about that. Also recently, as far as family changes, an aunt had recently moved out that she was really, really close to. And so once I got that information, I told the mom, I was like, I want to help support her to ask her if this is what's wrong. So we signed it to her. She was able to say, yes, she was mad because she was actually scared, not just mad because mom and dad were arguing. So we let the mom explain to her and interpret for her that mom and dad are okay and that they're not mad at each other anymore. And then secondly, explain to her the next time when she would see her aunt. And I encouraged the parent to make a calendar so that she would know, like, when will she be able to visit the aunt? When will the aunt be coming over? Will they do something fun together? And stress the importance to the family of explaining when things are going to happen, or if there's a change, explaining that that change is going to occur to the deaf or hard of hearing child before it happens.